Yes, an artificial cornea, also known as a keratoprosthesis, can help individuals with corneal blindness to regain vision. The cornea is the clear, front part of the eye that helps focus incoming light onto the retina. When the cornea becomes damaged or diseased, it can result in significant vision loss or blindness. Artificial corneas are designed to replace the damaged cornea and restore visual function. They are typically made of biocompatible materials such as polymers or synthetic materials that mimic the transparency and shape of a natural cornea. The prosthetic cornea is surgically implanted into the eye, replacing the damaged or diseased cornea. There are different types of artificial corneas available, including full-thickness and partial-thickness keratoprostheses. Some designs involve the use of a donor cornea combined with an artificial component. The specific type of keratoprosthesis used depends on the individual's eye condition and the surgeon's recommendation. While artificial corneas can help restore vision in individuals with corneal blindness, it's important to note that the success of the procedure may vary depending on several factors, such as the underlying cause of blindness, the overall health of the eye, and the surgical technique used. Additionally, like any surgical procedure, there are potential risks and complications associated with the implantation of an artificial cornea. It's advisable for individuals considering artificial cornea surgery to consult with an experienced ophthalmologist or corneal specialist who can assess their specific condition and provide appropriate guidance and treatment options.